What alcohol does to your body, brain, and health. Alcohol, when consumed, has a profound impact on the brain. It acts as a central nervous system depressant, altering various neurotransmitters and brain functions. Upon entering the bloodstream, alcohol reaches the brain and slows down its activity. It enhances the effects of gamma-aminobutyric acid, GABA, an inhibitory neurotransmitter, resulting in relaxation, decreased inhibitions, and impaired judgment. At the same time, alcohol inhibits the function of glutamate, an excitatory neurotransmitter, leading to decreased alertness and coordination. Prolonged and excessive alcohol consumption can damage brain cells, particularly in areas associated with memory, learning, and decision-making. It can also disrupt the balance of other neurotransmitters, leading to mood changes and potentially increasing the risk of mental health disorders. While moderate alcohol consumption may have limited short-term effects, excessive or chronic alcohol use can have severe and long-lasting consequences for brain health. The effects of hangover. Hangovers are the unpleasant after-effects that occur after consuming excessive amounts of alcohol. The exact mechanisms behind hangovers are not fully understood, but several factors contribute to their effects on the body. Dehydration is a significant component of a hangover, as alcohol is a diuretic that increases urine production and leads to fluid loss. This can result in symptoms like thirst, fatigue, and headaches. Alcohol also irritates the stomach lining, causing nausea and vomiting. Additionally, alcohol disrupts sleep patterns, leading to poor quality sleep and fatigue the next day. Hangovers can also cause cognitive impairment, difficulty concentrating, and sensitivity to light and sound. While time, rest, and rehydration are the most effective remedies for a hangover, prevention is the best approach. Consuming alcohol in moderation, alternating alcoholic beverages with water, and eating before drinking can help minimize the severity of hangover symptoms. What to do if you have a hangover? If you find yourself dealing with a hangover, here are some steps you can take to alleviate the symptoms and promote recovery. Hydrate. Replenish the fluids lost due to alcohol's dehydrating effects by drinking plenty of water or electrolyte-rich beverages like sports drinks or coconut water. Rest. Allow your body to recover by getting sufficient rest and sleep. Take it easy and give yourself time to recover fully. Eat a balanced meal. While you may not feel like eating, consuming a light, nutritious meal can help restore depleted nutrients and stabilize your blood sugar levels. Opt for easily digestible foods like toast, crackers, or a banana. Take over-the-counter pain relievers. Non-prescription pain relievers such as ibuprofen or aspirin can help alleviate headache and muscle aches. However, avoid acetaminophen, paracetamol, as it can potentially interact with the liver when combined with alcohol. Replenish electrolytes. Alongside water, consider drinking sports drinks or consuming foods rich in electrolytes to restore the body's electrolyte balance. Avoid caffeine. Although it might be tempting to reach for coffee, caffeine can further dehydrate you and potentially worsen your symptoms. Stick to non-caffeinated beverages instead. Use ginger or peppermint. Ginger or peppermint tea can soothe an upset stomach and help relieve nausea. Sip on these herbal teas to find relief. Avoid further alcohol consumption. While a hair of the dog may provide temporary relief, it ultimately prolongs the recovery process. It's best to abstain from alcohol until you have fully recovered. Remember that prevention is key to avoiding hangovers. Drink responsibly, moderate your alcohol intake, and pace yourself to reduce the likelihood and severity of hangover symptoms. Making informed decision about consuming alcohol. Making informed decisions about consuming alcohol is crucial for your overall well-being. Here are some key factors to consider. Understand the risks. Educate yourself about the potential risks and health effects associated with alcohol consumption. Excessive or long-term alcohol use can lead to various health problems, including liver damage, cardiovascular issues, addiction, mental health disorders, and impaired cognitive function. Know your limits. Be aware of your personal tolerance and the recommended guidelines for moderate alcohol consumption. Moderate drinking is generally defined as up to 1 drink per day for women and up to 2 drinks per day for men. However, individual factors such as age, weight, overall health, and any medications you may be taking can affect your tolerance. Consider your health conditions and medications. Some health conditions and medications may interact negatively with alcohol. Consult with your healthcare provider to determine whether alcohol consumption is safe for you based on your specific circumstances. Plan ahead. If you choose to drink, it's important to plan ahead to minimize risks. Designate a sober driver, arrange alternative transportation, or use rideshare services to avoid driving under the influence. Set boundaries and practice moderation. Establish personal boundaries and stick to them. Avoid binge drinking and excessive alcohol consumption. Pace yourself, alternate alcoholic beverages with water or non-alcoholic options, and be mindful of your alcohol intake. Prioritize hydration and nutrition. Alcohol can dehydrate the body and deplete essential nutrients. Stay hydrated by drinking water alongside alcoholic beverages and ensure you're maintaining a balanced diet to support your overall health. Be aware of your surroundings. Alcohol can impair judgment and decision-making abilities. Stay in safe environments, be mindful of your personal safety, and avoid risky behaviors that may lead to harm or regret. Listen to your body. Pay attention to how alcohol affects you individually. If you notice negative physical or emotional effects, such as hangovers, mood swings, or disrupted sleep, consider reducing or eliminating alcohol consumption altogether. Ultimately, the decision to consume alcohol or not is a personal one. By understanding the risks, setting boundaries, and making informed choices, you can promote a healthier relationship with alcohol and prioritize your well-being. The danger of alcohol among young people. Alcohol poses significant dangers to young people due to various factors. Firstly, the adolescent brain is still developing, and alcohol can have detrimental effects on its structure and function. Heavy alcohol consumption during this critical period can impair cognitive abilities, memory, and learning, potentially leading to long-term consequences. Secondly, underage drinking is associated with an increased risk of engaging in risky behaviors such as unsafe sexual activity, driving under the influence, violence, and substance abuse. Young people are more susceptible to the negative effects of alcohol due to their limited experience and judgment. Moreover, early alcohol use is linked to an increased likelihood of developing alcohol dependence later in life. It is crucial to educate and support young individuals to make informed decisions regarding alcohol, emphasizing the potential dangers and encouraging responsible drinking habits, or even abstaining altogether. What is chronic intake of alcohol? Chronic intake of alcohol refers to a pattern of regular and excessive alcohol consumption over an extended period. It involves consistently drinking large amounts of alcohol, often beyond the recommended guidelines for moderate drinking. Chronic alcohol intake can have severe and detrimental effects on both physical and mental health. Prolonged alcohol abuse can lead to serious medical conditions such as liver disease, cardiovascular problems, pancreatitis, and increased risk of various types of cancer. It can also cause significant damage to the brain, resulting in cognitive impairment, memory loss, and an increased susceptibility to mental health disorders such as anxiety and depression. Chronic alcohol intake can lead to addiction or alcohol use disorder, AUD, characterized by an inability to control alcohol consumption and the presence of withdrawal symptoms when attempting to quit. Seeking professional help and support is essential for individuals struggling with chronic alcohol intake to address the physical, psychological, and social consequences associated with this condition. What data say about chronic intake of alcohol? Studies find that people drink 7 to 14 drinks per week. When consuming 7 to 14 drinks per week, it is considered moderate alcohol intake for men and within the low-risk range according to some guidelines. However, it's important to note that individual responses to alcohol can vary, and the consequences of alcohol consumption can differ from person to person. Here are some potential consequences that can arise from sustained moderate alcohol intake. Increased health risks. Even within the moderate range, regular alcohol consumption can still contribute to health issues. These may include liver problems, increased risk of certain cancers, such as breast, liver, and mouth cancer, cardiovascular conditions, gastrointestinal disorders, and compromised immune function. Negative impact on mental health. Alcohol is a depressant, and while moderate drinking may not have severe immediate effects, sustained alcohol consumption can negatively impact mental health. It can contribute to the development or exacerbation of mood disorders, including anxiety and depression. Alcohol can also impair cognitive function, memory, and overall brain health. Dependency and addiction risks. Consistent moderate alcohol intake can potentially lead to the development of alcohol use disorder, AUD, or alcohol addiction. Over time, the body can develop tolerance to alcohol, leading individuals to consume larger amounts to achieve the same effects. This can create a cycle of increased alcohol consumption and dependence. Increased risk of accidents and injuries. Even moderate alcohol consumption can impair judgment, coordination, and reaction times, increasing the risk of accidents and injuries. These can include falls, car accidents, workplace incidents, and other mishaps that can cause physical harm or endanger others. Social and interpersonal consequences. Excessive or frequent alcohol consumption, even within the moderate range, can strain relationships, negatively affect work performance, and impact overall social functioning. It may lead to conflicts, impaired decision-making, and diminished productivity. It's important to remember that these consequences can vary depending on individual factors such as genetics, overall health, and other lifestyle choices. It's always wise to assess and monitor your alcohol intake, be aware of any potential adverse effects, and seek support if you have concerns about your drinking habits. Many people drink to change how they feel. Many individuals turn to alcohol as a means to alter their emotional state and how they feel. The consumption of alcohol can temporarily provide a sense of relaxation, stress relief, or escape from negative emotions. People may drink to numb emotional pain, alleviate anxiety, boost confidence, or enhance social interactions. However, relying on alcohol as a coping mechanism can be problematic. While alcohol may initially provide a temporary respite, it is not a sustainable or healthy solution for managing emotions. Excessive or frequent alcohol use can lead to dependency, worsen underlying emotional issues, and create a cycle of relying on alcohol to regulate emotions. It is important to explore healthier coping strategies, such as engaging in therapy, practicing self-care, seeking support from loved ones, and adopting stress reduction techniques to address emotional well-being effectively. What happens when a person is no longer under alcohol influence after the hangover? Talking about the loss of feeling, and why some keep hiding behind alcohol. When a person is no longer under the influence of alcohol after a hangover, they may experience a loss of the temporary numbing or escapism that alcohol provided. This loss of feeling can be challenging for some individuals, leading them to continue hiding behind alcohol for various reasons. Emotional discomfort. Without the numbing effects of alcohol, individuals may confront underlying emotional discomfort, such as unresolved trauma, stress, anxiety, or depression. Alcohol can temporarily provide relief from these emotions, and without it, these feelings resurface, potentially causing distress. Coping mechanism. Some individuals may use alcohol as a coping mechanism to deal with life's challenges and stressors. It can serve as a way to temporarily escape or numb unpleasant emotions. When sober, individuals may struggle to find alternative coping strategies, leading them to rely on alcohol as a means of emotional regulation. Social anxiety or inhibition. Alcohol can lower inhibitions and ease social anxiety, making it easier for individuals to interact with others and feel more comfortable in social situations. Without the influence of alcohol, they may experience heightened social anxiety or find it difficult to engage socially, leading them to continue relying on alcohol as a social lubricant. Habit and dependence. Regular or excessive alcohol consumption can lead to habit formation and dependence. The body and mind can become accustomed to relying on alcohol to function or feel normal. Breaking this cycle can be challenging, as individuals may fear facing withdrawal symptoms or struggle with cravings. Lack of alternative coping skills. Individuals who hide behind alcohol may not have developed or explored healthier coping mechanisms. they may be unaware of alternative ways to manage stress, regulate emotions, or seek support. Without these skills, they may default to using alcohol as their primary coping strategy. It is important to recognize that relying on alcohol to cope with emotions or life's challenges can lead to further complications and potential negative consequences. Seeking professional help, such as therapy or counseling, can provide individuals with the necessary tools and support to address underlying emotional issues and develop healthier coping strategies. Biochemical impact of alcohol to the body. Alcohol has a significant biochemical impact on the body. When consumed, it is rapidly absorbed into the bloodstream and affects various organs and systems. In the liver, alcohol is primarily metabolized by enzymes into acetaldehyde, a toxic substance that further breaks down into harmless byproducts. This process can strain the liver and potentially lead to liver damage over time. Alcohol also affects neurotransmitters in the brain, such as gamma-aminobutyric acid, GABA, and glutamate, which regulate inhibitory and excitatory signals, respectively. This results in the characteristic sedative and impairing effects of alcohol on cognition, coordination, and behavior. Additionally, alcohol affects the release of endorphins and dopamine, contributing to the pleasurable and rewarding sensations associated with drinking. Prolonged and excessive alcohol consumption can disrupt the delicate balance of these biochemical processes, leading to a range of health issues, including addiction, liver disease, neurological damage, and increased vulnerability to mental health disorders. What does alcohol do to the blood-brain barrier known as BBB? Alcohol can have an impact on the blood-brain barrier, BBB, which is a protective barrier between the bloodstream and the brain that helps regulate the movement of substances into and out of the brain. Here's how alcohol affects the BBB. Disruption of the BBB. Alcohol has been found to disrupt the integrity of the BBB, making it more permeable to certain substances. This increased permeability can allow the entry of harmful substances, toxins, and inflammatory molecules into the brain. Neuroinflammation. Alcohol-induced disruption of the BBB can trigger an inflammatory response in the brain. This inflammation can contribute to neuronal damage and impair brain function. Increased susceptibility to brain damage. When the BBB is compromised, the brain becomes more vulnerable to damage from various factors, including alcohol itself. The increased permeability allows alcohol and its metabolites to enter the brain more readily, potentially causing direct toxicity to brain cells. Impaired neurovascular coupling. Alcohol's effects on the BBB can disrupt the regulation of blood flow in the brain, known as neurovascular coupling. This impairment can negatively impact brain function and contribute to cognitive deficits. Impact on neurotransmitter balance. The BBB helps maintain the balance of neurotransmitters in the brain. Alcohol's influence on the BBB can disrupt this balance, affecting the functioning of various neurotransmitter systems, including those involved in mood regulation, cognition, and behavior. Contribution to alcohol-related brain disorders. The disruption of the BBB and the subsequent effects on brain function and inflammation play a role in the development and progression of alcohol-related brain disorders, such as alcoholic dementia and Wernicke-Korsakoff syndrome. It is important to note that the effects of alcohol on the BBB can be influenced by various factors, including the amount and duration of alcohol consumption, individual susceptibility, and overall health. Chronic and heavy alcohol consumption is more likely to have a pronounced impact on the BBB and brain health. How alcohol and depression are related. Alcohol and depression can be related in several ways, although the relationship is complex and can vary among individuals. Here are some key aspects of the relationship between alcohol and depression. Self-medication. Some individuals with depression may turn to alcohol as a means of self-medication. They may use alcohol to temporarily alleviate symptoms of sadness, anxiety, or low mood. Alcohol can provide a temporary sense of relief or escape, but it does not address the underlying causes of depression and can ultimately worsen symptoms in the long run. Dual diagnosis. Alcohol use disorder, AUD, and depression often co-occur, leading to a dual diagnosis. These conditions can interact and exacerbate each other, creating a cycle of negative impact on mental health. alcohol can contribute to or worsen depressive symptoms, while depression can increase the risk of developing an alcohol use disorder. Neurochemical effects. Alcohol affects the brain's neurotransmitters, including dopamine, serotonin, and norepinephrine, which play crucial roles in mood regulation. In the short term, alcohol's impact on these neurotransmitters can induce temporary feelings of euphoria. However, prolonged alcohol use can disrupt the delicate balance of these chemicals, leading to imbalances that can contribute to or exacerbate depressive symptoms. Social factors. Alcohol use often occurs in social settings, and individuals with depression may turn to alcohol as a way to cope with social anxiety or feel more comfortable in social situations. However, excessive or problematic alcohol consumption can lead to social isolation, strained relationships, and further exacerbate feelings of depression. Negative consequences. Excessive alcohol consumption can have numerous negative consequences, including impaired cognitive function, poor sleep quality, decreased motivation, and increased feelings of guilt or shame. These consequences can contribute to the development or worsening of depressive symptoms. It is important to note that while alcohol may provide temporary relief from depressive symptoms, it is not a suitable long-term solution. In fact, alcohol can worsen depression and make it more challenging to effectively manage the condition. Seeking professional help, such as therapy, counseling, or medication, is essential for addressing depression effectively, and it often involves addressing any co-occurring alcohol-related issues as well. The best way to stop alcohol consumption. Stopping alcohol consumption can be a challenging process, but there are several effective strategies that can help individuals successfully quit or reduce their alcohol intake. Here are some key steps to consider. Set a clear goal. Define your goal regarding alcohol consumption. It could be complete abstinence or reducing alcohol to a moderate and responsible level. Having a clear goal helps you stay focused and motivated throughout the process. Seek support. Reach out to your support network, including friends, family, or support groups like Alcoholics Anonymous, AA. Sharing your decision to stop drinking with trusted individuals can provide encouragement, understanding, and accountability. Consider joining a support group or seeking professional help from a therapist or counselor experienced in addiction. Identify triggers and develop coping strategies. Identify the situations, emotions, or events that tend to trigger your desire to drink. Develop alternative coping strategies to deal with these triggers. This could involve engaging in physical activities, practicing relaxation techniques, pursuing hobbies, or seeking healthier outlets for stress relief. Make lifestyle changes. Examine your lifestyle and make positive changes that support your decision to stop drinking. This could include avoiding social settings where alcohol is prevalent, finding new hobbies or interests that don't involve alcohol, and surrounding yourself with supportive and like-minded individuals. Create a supportive environment. Remove alcohol from your home and surroundings. Discard any alcohol you have, and avoid keeping it within easy reach. Surround yourself with people who support your decision to stop drinking and who engage in activities that do not revolve around alcohol. Take care of your physical and mental health. Focus on improving your overall well-being. This includes adopting a healthy diet, engaging in regular exercise, prioritizing sleep, and managing stress effectively. Taking care of your physical and mental health can help reduce the desire to turn to alcohol for coping. Celebrate milestones. Acknowledge and celebrate your achievements along the way. Set smaller milestones, such as days, weeks, or months without alcohol, and reward yourself for reaching these goals. Celebrating your progress can provide positive reinforcement and motivation to continue on your alcohol-free journey. Remember, quitting alcohol is a personal process, and everyone's journey is unique. If you find it difficult to stop drinking on your own, don't hesitate to seek professional help. A healthcare professional or addiction specialist can provide tailored guidance and support to help you successfully quit alcohol and maintain sobriety. Stopping alcohol cold turkey. Stopping alcohol cold turkey means abruptly and completely ceasing alcohol consumption without any gradual reduction. While some individuals may be able to successfully stop drinking alcohol this way, it can be challenging and potentially risky for others, especially those who have been consuming alcohol heavily or have developed a physical dependence on it. Here are some important considerations. Withdrawal symptoms. Abruptly stopping alcohol after heavy and prolonged use can lead to withdrawal symptoms, which can range from mild to severe. Common symptoms include tremors, anxiety, sweating, nausea, insomnia, irritability, and in severe cases, seizures or delirium tremens. These withdrawal symptoms can be dangerous, and medical supervision may be necessary to ensure safety and provide appropriate support. Medical assessment. If you have been a heavy or long-term drinker, it is important to consult with a healthcare professional before attempting to quit alcohol cold turkey. They can assess your physical and mental health, evaluate any potential complications, and provide guidance on the safest and most appropriate approach for you. Medical support. In some cases, medical support may be needed to manage alcohol withdrawal. This can involve a medically supervised detoxification process in a hospital or specialized facility. Healthcare professionals may administer medications to help alleviate withdrawal symptoms, monitor vital signs, and provide necessary care during the early stages of alcohol cessation. Emotional support. Quitting alcohol cold turkey can be emotionally challenging. It is important to seek emotional support from loved ones, support groups, or counseling services to help you navigate the emotional aspects of alcohol cessation and provide additional motivation and encouragement. Long-term recovery plan. Stopping alcohol abruptly is just the first step. Developing a long-term recovery plan that includes ongoing support, therapy, and lifestyle changes is crucial for maintaining sobriety and addressing the underlying reasons for alcohol misuse. It is essential to understand that quitting alcohol cold turkey may not be appropriate or safe for everyone, particularly those with a severe alcohol dependence. Seeking guidance from healthcare professionals and addiction specialists can provide personalized advice and support tailored to your specific situation. Effect of alcohol on our immune system. Alcohol can have a detrimental effect on the immune system, weakening its ability to protect the body against infections and diseases. Here are some key ways alcohol impacts the immune system. Impaired immune cell function. Alcohol can suppress the function of immune cells, including white blood cells, which are responsible for fighting off pathogens and infections. This impairment reduces the immune system's ability to recognize and destroy harmful microorganisms, making individuals more susceptible to infections. Inflammation. Chronic alcohol consumption can trigger inflammation in the body. Excessive inflammation can disrupt immune system regulation and lead to immune dysfunction. Prolonged alcohol-induced inflammation can contribute to a range of health issues, including liver disease, cardiovascular disease, and impaired wound healing. Increased susceptibility to infections. Alcohol weakens the body's defenses against infections, making individuals more vulnerable to various illnesses. It increases the risk of respiratory tract infections, such as pneumonia, as well as infections in other parts of the body. Alcohol can also impair the effectiveness of vaccines, reducing the body's ability to generate a robust immune response. Altered gut microbiome. Alcohol disrupts the balance of the gut microbiome, the collection of microorganisms that play a vital role in immune system regulation. Disruption of the gut microbiome can compromise immune function and contribute to increased inflammation, gastrointestinal problems, and susceptibility to infections. Slowed wound healing. Alcohol impairs the healing process by interfering with the production of new cells and collagen synthesis. This delayed wound healing can make individuals more prone to infections and prolong the recovery time from injuries or surgeries. Increased risk of certain diseases. Chronic alcohol consumption weakens the immune system over time, increasing the risk of developing certain diseases. These may include infections such as pneumonia, liver diseases, example, alcoholic hepatitis, cirrhosis, certain cancers, and autoimmune disorders. Reducing or eliminating alcohol consumption can help improve immune system function and overall health. Moderation or abstinence from alcohol, along with a healthy lifestyle that includes proper nutrition, regular exercise, adequate sleep, and stress management, can support a stronger immune system and reduce the risk of infections and related health complications. My own experience, and how one word made me stop drinking alcohol. We have seen that people on average take 7 to 14 drinks per week, right? I was a heavy drinker, so to speak. I was under alcohol influence at least most of the time. I do not even remember how I used to live my life, as I used to drink at least 6 cans of beer every single day, for weeks a month, and 12 months a year. What a life it was! I had a full-time job, and could find time for football and many more activities because I thought I was living a normal life like many do when they are under alcohol influence, but in reality they are not living, as we are going to see, how I found out that indeed I was not living. One word, done, changed everything in a fraction of a second. How did this happen? Well, long story short, a voice came to me and said, "Why are you doing this to me? God, and buy a Bible and start reading it." I had never read the Bible before, but perhaps I happened to open the Bible once or twice because we all grew up thinking that the Bible was only for the priests, especially when you grew up under the influence of the Catholic Church. The moment I started to read the Bible, things changed, and just when I came to Exodus, which is the second book of the Bible, the people of God were moving around building the tent. They came to a new place where they built the tent, and presented it to God, and God was very happy. It is done. This is the word that changed my life, done. I don't know how it happened, and done hit my mind like 3 times, done, 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 and I immediately realized that God was talking about cigarettes that I was heavily smoking back then, which I will make another video about later. Now, the greatest fight started between me and God, saying, "God, now you made me quit smoking." I admit that I had learned this bad behavior in my late 20s, but alcohol has always been my life. Are you telling me that I must stop drinking alcohol too? It took me about a year fighting, and in the end God gave me a sign that made me realize that if I didn't stop drinking alcohol, things would have gone worse. I had started to read the Bible, stopped smoking, and the final battle was alcohol. The voice came to me and said, "You refuse to stop drinking, I will show you. You are going somewhere, this and that will happen to you, and you will know that I have spoken." I remember well, one Saturday, I had taken my 6 cans of beer as usual, but that day felt tired and I slept. I was on bed around 10 p.m. While sleeping, a phone call came in, and it was a friend calling me to go out, and I didn't even think twice. I took a quick shower, and went to town. The rest is prophecy, and what happens in town stays in town. It happened exactly the way God had described to me, and that's when I put an end to alcohol and never looked back ever since. It has been 6 years now. My advice to you, it is better to find your true life, and live a sober life, because all those bad habits we do practice, we inherit them from other people, and they are not who we are. Thank you for watching, and if this video blessed you, please subscribe, like and share. God bless you. Shalom.